Are you a woman in your 40s or 50s and all of a sudden you developed anxiety for the first time in your life, or maybe depression, and you're having brain fog that's unreal? Then this video is for you. My name is Dr. Ruth Dunn. I'm a board certified adult psychiatrist. And one of the areas of mental health where there has not been enough discussion amongst both providers and patients is what happens in that perimenopausal state. So perimenopause is the period between when you start to experience some changes in your hormones, irregular periods, up until a year after your last menstrual cycle. And so once you've reached a year past your last menstrual cycle, then you would be postmenopausal. So for most women, menopause occurs between 49 and 52. That's the average. So perimenopause for most women starts early to mid 40s, but this can definitely vary. There are women who start perimenopause in their 30s, even their 20s. So while there are at least 40 individual symptoms associated with perimenopause, some of the most disruptive ones are those related to mental health and cognition. So it's not uncommon for me to have a woman coming to me to see a psychiatrist for the first time. She's in her 40s or 50s, and she's complaining of these new mental health symptoms, or she's worried that she has dementia. And although there are certainly some cases where people may benefit from psychiatric medications, it's important to keep in mind what is going on hormonally in these women, and that may be the root cause of their symptoms. So in perimenopause, your hormones are kind of all over the place, but as a general trend, your estrogen, progesterone, and testosterone are all dropping. And it's the balance of these hormones during our reproductive years that keep us happy, healthy, energized, and in sync with our normal body rhythms. So what do we do about these new symptoms in the 40s and 50s? Well, I think it's important to talk with your medical provider about the symptoms you're having. Of course, other perimenopause symptoms can include things like hot flashes, vaginal dryness, low energy, fatigue, irregular periods, of course, and more. We know that hormone replacement therapy can be really helpful for these symptoms if they're related to these changes in your hormones, and that women who are having these symptoms due to their perimenopause changes in hormones who are started on antidepressants do not do as well as other people with those antidepressants. So before we start a potentially unnecessary medication, it's important to address those underlying hormonal changes. And in addition to hormone replacement therapy, there are other strategies, lifestyle strategies that can be hugely beneficial, like engaging in regular exercise, both cardiovascular and resistance training, eating a diet that's full of protein, healthy fats, fiber, engaging in stress reduction techniques, prioritizing sleep. And in some cases, there may be some supplements that are helpful for these things. But what I want you to take away from this video is that there's nothing wrong with you. You're going through a life transition. There's a very good chance that what you're experiencing is related to your hormones, and that this will pass after you're through that perimenopausal period. But at the same time, there's no need to suffer while you're going through it. There are medications and treatments that are helpful to treat the perimenopause symptoms, and that these often will address those mental health symptoms that you may be experiencing. If you have any questions about this, feel free to put in the comments below. Wishing you all good mental health today, and I'll see you in the next one.